Here at the Penn State Hershey Inflammatory Bowel Disease Center, we strive to be a national and world leader in the clinical care of patients with inflammatory bowel disease. Related to that is the research that's involved in trying to understand the pathophysiology of that disease, as well as doing research that will further our aim of finally finding a cure for inflammatory bowel diseases. The advantage of the Penn State Hershey Inflammatory Bowel Disease Center is that all of the caregivers necessary to care for these very complex patients are under one roof. We effectively can see them very quickly, and frequently patients are seen both by a gastroenterologist and a surgeon at the same sitting. There are numerous other subspecialists readily available in the same vicinity so that any patient who has any form of complication can be seen almost immediately in order to implement a care strategy for that individual patient quite quickly. A unique aspect of our Inflammatory Bowel Disease Center is that nearly all of our patients that we care for are recruited into our Inflammatory Bowel Disease Biobank. This biobank has been in place for over 15 years and now has over 2,000 patients within it, from whom we've got DNA, white cells, as well as tissue, so that research can be done in a correlative fashion. Any genetic findings that we discover, we can then evaluate more thoroughly in the tissue that has been harvested from the same patient during their surgery.
Alongside the world-class care that we're trying to provide for our IBD patients, we're also trying to really be a center where we can educate both our providers in our community, but also the patients that suffer from these debilitating diseases. And so a group of people from our Inflammatory Bowel Disease Center go out, usually to a local Penn State facility, and we educate the patients about the disease and about the medications that we use. We find a lot of patients who come to us, they may have had the disease for a long time, and yet they still don't know exactly what disease they have. They still don't know exactly where the disease is, why the doctor has given them a certain medication. And so we're sort of starting fresh with these patients in the hope that we sort of empower them to sort of take control of the disease and be more active participant in their care.
Here at Penn State Hershey Medical Center, we have a pediatric inflammatory bowel disease transition clinic. This is really important because patients who start out as children are eventually going to become adults and still need to be cared for with their disease condition. The transition clinic allows us to take them through that process of learning how to take care of themselves as opposed to having their parents do it, as well as learning when they need to call a doctor, who to call, the names of their medicines, or the name of the disease they actually have. And learning those tricky things that are difficult to handle that their parents used to handle and now they need to handle.
Sometimes in the past it's been occasionally challenging for patients with inflammatory bowel disease, physicians, primary care doctors to know how to access our system and have access to our subspecialists. And so one of the things that we made available is a nurse navigator. She's available during all office hours to take phone calls from physicians, even from patients. And we try and get the patients, again, at the right place at the right time, have the appropriate studies done so that the patients come with all the appropriate studies and records. And so a lot of the homework that needs to be done before is done by the nurse navigator. So when the patient comes for their first appointment, they are ready to be seen. We have tried to evaluate everything that we need.
We're performing most of our elective and even a good portion of our emergent IBD-related surgeries through a laparoscopic approach, and in our case through a single incision, which is either placed in the belly button or placed at the site where we are planning on creating a stoma or where the patient might require a temporary stoma. Those patients who have a laparoscopic approach to their surgery will have less postoperative discomfort, will have a shorter length of hospital stay, and a greater satisfaction because of the fact that they have less discomfort.
I had already been previously diagnosed with IBD, UC, and Crohn's disease, and being an endoscopy technician, it allows me to connect with the IBD patients that come through. I can relate to them, reassure them, and let them know that I do understand what they're going through, but I can also educate staff who may not be as familiar with the disease and what the patient may or may not be feeling at the time.
Here at the Penn State Hershey Inflammatory Bowel Disease Center, it may be a small town, but we have all the sophisticated equipment and expertise necessary to provide the best and world-class care for patients with inflammatory bowel disease.